Hello again from a new season from Brain Talk, and this season we'll talk about calcification on CT. So the intracranial calcification has a high density in the cranial CT. Usually, the value is equal or more than 100 Hounsfield unit. So the intracranial calcification can be divided to the physiological and pathological. So understanding the physiological location, distribution, and pathological condition of the intracranial calcification is helpful to prevent misdiagnosis and give a unique diagnosis. First, we will start talking about the physiological calcification. Physiological calcification can be divided as two. Firstly, we have the pineal gland calcification, choroid plexus, cerebral falx, basal ganglia, dentate nucleus calcification, and it's seen more common in the older people. As we see here in the CT, firstly, here the tentorium has been calcified in the linear calcification. And here are the third ventricle and the pineal gland and the choroid plexus also had been calcified here. Here also the choroid plexus. And here is the tentorium has been calcified. Here is the pineal gland calcification, as we see in this picture and this picture, and here also. Here is the nodular, here is a patchy, shape. And it can be, more than one shape or two shapes. Here is, strip of calcification on the falx cerebri in older people. Bilateral calcification in the globus pallidus in both two sides, as we see in this picture. Another calcification had been found on the right side of the caudate nucleus. So moving to another calcification, it's called the pathological calcification. First, we'll start with the brain insult. The brain insult can be due to calcification after trauma or surgery or hematoma, chronic hematoma. It may be like subdural, epidural hematoma. Here, a patient after coronectomy, after operation in the brain, as we see here, he is a nodular, and other nodular calcification. And with encephalomalacia, which indicates that the patient has a brain surgery. Here also a dural calcification, another dural calcification here, as we see also here calcification in this patient. Subdural hematoma chronic type, as we see in this picture, a calcified membrane in the subdural hematoma. Here in this area, here there is a calcification here also. Going to another reasons for pathological calcification, which be congenital calcification, like tuberous sclerosis, neurofibromatosis type 1, neurofibromatosis type 2, Sturge-Weber syndrome. Here, a nodular, sclerosis, as we see multiple calcified nodules has been found in the subependymal and also in other patients in the subcerebral cortex, in the tuberous sclerosis patient. And here, a neurofibromatosis type 1 patient, as we see here, this is a calcified area in the basal ganglia, and also, and as we see in this picture, and here also in these picture here is the optic-chiasm glioma. A storage river syndrome, left parietal atrophied with calcification in this area. It's like thumb-like calcified, which indicate a storage river syndrome. Third reason for pathological calcification is vascular related diseases. We have many types of vascular diseases. Firstly, the most common is atherosclerosis, aneurysm, arteriovenous malformation, developmental venous dysplasia, cavernous hemangioma, and lastly, the arteriovenous fistula. As we see here in these, pictures of CT, first we have here internal cardiac artery, here the basal artery, and here is the vertebral artery also in this area. We see more, calcification is like nodular, or like liner, is calcification inside the wall of these, arteries, and which can be seen in mostly in the older patient. And here is the aneurysm, as we see thrombotic aneurysm, which has a calcified in like annular in the annular wall of the arteries. Here one, and this is the other one, and this is another patient here. And also arteriovenous malformation, we have multiple calcification in the wall of the sublying artery, and in the same time in the thick draining veins. Developmental venous anomaly, multiple, small nodular, as we see in this picture. Here in this picture, this is nodular, calcification in the venous, in the developmental venous anomaly. We're surrounding by, what's called cubitus medius. Cavernous hemangioma also another reason for calcification in these patients. As we see here, small round calcification, which had been seen in the MRI here. That's maybe due to calcification to multiple, bleeding for cavernous hemangioma, which after that transfer to, the hematoma transfer to calcification. Number four, the reasons for calcification is tumor of the central nervous, the center of nervous system. We have firstly the metastatic tumor, oligodendroglioma, osteocytoma, craniopharyngioma, and meningioma. As we see here, firstly, we have here the metastasis of the patient which has colon cancer. This is a calcified tumor with finger-like edema. And here, oligodendroglioma in the frontal right side, and meningioma of the sphenoid wing here, which has small dotted calcifications. And here also we have meningioma, which has calcification inside it. Craniopharyngioma also has a calcification part inside the tumor, as we see in these pictures, in these patients. Ependymoma with calcification in the fourth ventricle is another, reason for, or another what we see in some, tumors of the central nervous system. And number five, the reason for calcification is infection disease, like cytomegalovirus, toxoplasma infection, cystocrosis, HIV, tuberculosis. So here, a cytomegalovirus, which has seen here, multiple calcification around the ventricular system and another, part of the brain. And we have also cystocrosis with dotted calcification around the brain. HIV patient also has, have like calcification. And number 6 is the reason for calcification in the brain: metabolic diseases like Fachar disease, hypoparathyroidism, pseudo-hypoparathyroidism, and CEC syndrome, celiac disease, epilepsy, and bilateral occipital calcifications. As you see here, here is endocrine disease like Fachar disease or hypoparathyroidism. Here, CEC syndrome, which has occipital calcification. Other diseases, lastly, is other disease. Other disease like we have, mineralized microangiopathy, cerebral infarction, cerebral hemorrhage. As you see in this picture, we have, mineralizing, a microangiopathy in a 14 years old boy treated with, for ALL with radiation and chemotherapy. So we see multiple calcification in this patient. And by this, we finished our, brain talk about, calcification on CT. A happy Chinese New Year, and thank you so much.